No, Erica, you got to go. Welcome, everybody. How are you this evening? Shawn, can you hear me? Check,
I
check.
can hear you great. Thanks for having me on, Anthony.
Awesome, awesome. Well, welcome everybody to the sixth edition of Be Free TV, where you guessed it, we're going to be talking about freedom and how freedom-based solutions to government manufactured issues can make the lives of everyday people better. That's what we're all about here today, providing solutions and helping people today make their lives better, make government more accountable to their needs, and reduce costs on things like health insurance and healthcare. So we're going to be focusing on these things over the next couple of weeks here as we're on lockdown. I appreciate you joining us again tonight. We're going to take a shift from talking to other candidates running for office here. We've had a lot of fun the last week or so talking to folks like Larry Sharp and Spike Cohen running for vice president in the Libertarian Party and others as well. And tonight, I'm excited to shift gears just a little bit. And we're going to be talking to Mr. Shawn Needham, who's a pharmacist slash author slash small business owner in none other than Moses Lake, Washington, here in Washington State. So Shawn is a great guy, a friend of my campaign, and I couldn't be more grateful than to have you on the show tonight, Shawn. Thank you for joining us.
Well, thank you, Anthony. It is truly my honor. I really, when it's just great talking to people with like minds and just liberty-minded people. I just love it. So again, it's my pleasure to be on. So, and just to let everybody know is that the way I met Anthony is during my book writing process. My book is called Sickened: How the Government Ruined Healthcare and How to Fix It. During that process, somebody on Facebook says, "Hey, you need to meet this guy, Anthony. He's running for insurance commissioner." And so I reached out to Anthony and actually invited him on our radio show. My wife, who is also a pharmacist and of course owns a pharmacy with me, we have a radio show called Health Solutions with Shawn and Janet Needham, and Anthony was actually the third guest on it. And I am proud to say, at least a few weeks ago, I haven't checked lately, on Anthony's website, that live video is up on his website, and I'm super excited about that and feel honored to be a part of his campaign.
Yeah, well, your support means the world to me, and sharing ideas and learning from one another has been great. You have a wealth of knowledge, and somebody like myself, when we get into office, I need folks that we can rely on that have the right ideas to move things in the right direction, that are going to provide relief right away to people when it comes to things like their healthcare costs. So I'm excited to dive into that with you today. I know so many of you that are maybe tuning in right now follow my campaign specifically because of this issue. That this is really what my campaign is all about, is reducing costs on healthcare, reducing costs on insurance, where other politicians in the past have run on platforms such as affordable healthcare. When we get results that are anything but affordable, I want to be able to get into office in day one and have solutions that are going to reduce cost immediately. So we're going to dive into some of that here with Shawn, and you actually have a unique a unique view on insurance and healthcare reform from a couple of different perspectives. You're a pharmacist, so you're in the kind of the medical side of things, but you're also a small business owner. So you deal with the things like property and casualty insurance and such. So,
Yep.
I wanted to start actually with the kind of the business end of things here for a few minutes, because it's lesser talked about. As we'll dive into healthcare in great detail in a minute, but things like business insurance and what a pharmacist might need, or a contractor might need, a plumber might need, or a cosmetologist might need. Those things aren't cheap or, always readily as available or easy to deal with as, consumers might like. So, Shawn, tell me a little bit about what it's been like for you as a small business owner dealing with insurance companies. Tell me a little bit about what type of policy you have and how it's affected what you do as a business owner.
Okay, so that's a broad question, right? I mean, because when you talk about insurance, and I'm usually used to answering the health insurance question, but when you're talking about broad insurance, it's just that's a broad question with, like you say, we have to have liability insurance. We have to have, for our property, we own the building, we own the property, we own the pharmacy. So of course we have to insure all that, including the inventory and liability. So, and that's a big cost. Insurance is a big cost. Now, that cost is small compared to what health insurance cost is. So, I mean, the biggest cost for most small businesses is health insurance. Now, I have a different opinion on employers providing health insurance, and I wrote about it in my book. I believe that employees should be responsible for their own health. And you had a guest on the other day, Spike Cohen.
Yep.
And I tell you what, it was like he wrote my book. He talked about what started health insurance to be expensive. And of course, the government ruined it. I mean, read my book, Sickened, How the Government Ruined Healthcare. They're the ones that caused it to be expensive. They continue to cause it to be expensive. Back in the 40s, during World War II, there was going to be wage inflation, or the government thought there was going to be wage inflation. So our wonderful president, FDR, put on a price control on wages. So if Ford wanted to hire somebody from General Motors, they couldn't pay him any more money and say, well, I'm going to pay you, 15% more than you're going to make at Ford. So they couldn't do that. So they said, well, let's start offering hospital insurance. So if you go to the hospital, or your wife goes to the hospital, your family goes to the hospital, it will be covered. So that hospital insurance is really what started out. That's kind of where our traditional employer-sponsored healthcare insurance started out. And then, of course, in the 1960s, when the Medicare Act was passed and Lyndon Johnson signed it in 1964, that's when government really got involved in healthcare and prices skyrocketed. The numbers are in my book, but overutilization, increased pricing on each procedure, it's unbelievable. It's not unbelievable if you know what happens when government gets involved. So that's really what's made healthcare expensive, and that's what's a major expense these days. But it doesn't have to be. There are other options, and of course, if the government got out of the health insurance business, health insurance prices would go way down if they let people pick plans that might fit them. For instance, I have a healthy family. I'm healthy. My family's healthy. I don't want a plan with maternity coverage for one. In Washington State, at least you used to not be able to get a plan without maternity coverage. Well, that is very expensive. And I'm almost 50 years old and my wife is 53. We are not having any more kids. Why do we have to buy maternity coverage? I want high deductibles. And to me, a high deductible is $10,000. I'm willing to take that risk. I don't want my prescriptions covered. I'm a pharmacist. I don't need expensive prescriptions. I know how to get cheap prescriptions. I don't want prescription coverage. I want to opt out of all that stuff. I don't want doctor's visits. I want the major catastrophic stuff. I get cancer. My wife gets cancer. That's what I want. And really, when you look at it, if you could truly get policies like that for healthy people, health insurance would be a lot less expensive.
Yeah, I think there's a lot of things you touched on that are key. That as a libertarian, and one of the things I talk about heavily is the idea that what you want and what your neighbor want might not be the same. And right now we have a two-party system that likes to force one-size-fits solutions on everybody across the entire state and further across the entire country. And the things that I propose, like allowing catastrophic coverage, doesn't remove the possibility of selling Cadillac coverage, right? We can have the situation where Shawn can have a Shawn can have a high deductible, low coverage policy because it's the risk that he's decided that he's willing to take, and that's what brings his family the most value. And if I want a policy that covers everything under the sun, I can have that. And we're stuck in a rut here of a conversation where everybody wants to force their ideas on others. And we need to get back to the root of understanding that what Shawn and Anthony, or what Shawn's parents and Anthony's son, we don't all need the same thing, and that's okay.
Well, and that's why I like the libertarian principles. And as long it's up to individuals to decide, and that's why I wrote a book. The book was, I've been practicing pharmacist for over 25 years, and I say the book was 25 years in the thinking and 5 years in the making. It took me 5 years to write the book, and at my conversation with healthcare providers and patients for the last 25 plus years, I realized this thing was that it was a mess, and I realized too that what I took for granted and my wife took for granted, other people didn't know. So I feel that it is my purpose to educate and empower individuals that they are in charge of their own healthcare, not some insurance company, not some government bureaucrat. They are in charge of their own healthcare. And the best health insurance we have, period, is not some policy we can buy. It's how we take care of ourselves. That's the best health insurance we can have. So we shouldn't think that some policy is going to save us from catastrophic or save us from most sick type care. And most sick type care in America is largely preventable. We have a sick type system, a sick care system in our country where a lot of things are lifestyle disease. And those things are preventable, but patients need to be educated about that. Not everybody I take it for granted that I know it. So that's why I wrote a book. That's why my wife and I have a radio show, which you're going to be on in a few weeks, Health Solutions with Shawn and Janet Needham, where we discuss everything healthcare, including the politics of healthcare. And our pharmacy in 2002, I got to say, we were pioneers. In 2002, we finally had enough. And we said, no more insurance. We are going to go cash only. We're not going to bill insurance.
Were you taking any cash at that point? Or
yes,
what was your, if you had to recall back, what was your ratio of like cash to insurance? Just out of curiosity.
That's a great question, Anthony, and something that kind of comes up in my book. So our cash was probably at that time about, I'm guessing 35 to 40% in our pharmacy.
Okay.
But here's the thing. That was 2002. Medicare Part D came out in 2006. So in the early 2000s, or when I got out of pharmacy school in the 1990s, pharmacies had to be price competitive, especially with senior patients, Medicare age patients. There was no pharmacy benefit. So pharmacies had to be competitive. And once Medicare Part D passed and the government started paying for it, and then all of a sudden everybody had the same copay no matter what pharmacy they went to, guess what? Didn't matter what the price was. So as you can imagine, Medicare Part D was touted by our wonderful Congress people who, that's kind of the straw that broke the camel's back with me. I used to be a staunch Republican, and when they passed Medicare Part D and the Republicans did, and they bragged about it going to be able to save money, my argument was, well, first of all, it's not. I ain't buying it. And second of all, whether it saves money or not, I believe it's unconstitutional. I don't believe that we should be I don't believe the federal government has any job that it is nowhere in the Constitution where it says the federal government should provide prescription coverage or health care for that matter. If somebody can find that in the United States Constitution, let me know. I'll read it, but I don't think it's there. So I told him that, and he says, well, this was Doc Hastings, and he says, well, we do a lot of things that are unconstitutional, but they're here to stay.
Yes, we do. Yes,
yeah, we do. And he admitted it. But here's what I said, Anthony, and this is one of the fixes in my books. Don't listen to politicians that say that, Republican or Democrat, when they say, well, we do a lot of things, because my personal opinion is Social Security is unconstitutional. The government is stealing money from me and saying they're going to give it to me later. I would much rather have that money so I could invest that money. Okay, that being said, I said, you know what, Doc Hastings, I says, I'm not a Republican anymore. And that's one of the reasons why. And he said, and I said this, I said, you know what? We can repeal those laws. He says, well, no, not really. I said, hey, we did it with prohibition of alcohol. So if enough people stand up and say, you know what, we're done with this, we want our money back, we repealed prohibition of alcohol. That's a big deal. I think that was a time in our country where you can use that example of a lot of things. People realized how ridiculous that was. Think about prohibition of alcohol. People were dying gangster style with Tommy guns being shot for selling alcohol. How ridiculous was that, right? So we look back 100 years later.
It's for your own safety.
Exactly, right. And now, of course, we've got it with all the drug wars. We've created that with all the drug wars. And so that's the analogy I use, is like, wait a minute, you can change it. We changed prohibition of alcohol. We can change those things. So I'm not giving up on that. That's probably the toughest step. There's a 6-step solution in my book, and that's the toughest step. The federal government step is the toughest step.
Yeah, I mean, and in Washington here, we have all the federal regulations over the top of us for how healthcare works, how insurance works. But the wonderful Washington State Legislature, with the proud blessing of the incumbent insurance commissioner, have essentially duplicated all the federal regulations down to the state level. So we have to put in twice as much work here to get back, half as much freedom as we once had. And I think you would agree that there's a lot of different components to why healthcare is broken. One of the issues that I'm seeing right now is in the political sphere of this conversation. You hear about Medicare for all, right? The left really wants Medicare for all. And I have to look at them and understand that the reason why they want Medicare for all, I believe, in most cases, because like you and I, they see what's in front of them is broken. What they aren't being shown by politicians in either party is any ounce of admitting how the government broke it or what other non-government solutions there might be. And the Republicans aren't offering any solutions there. And the Democrats are only offering one size fits all for the entire country. Take it, right? And even if you don't want it, you get it, you're paying for it. So I've been excited and to be traveling around the state and talking about some of the specific, maybe root cause issues and what maybe a simple solution would be for some of those things, right? So healthcare is expensive. Let's talk about pharmacy for a second and pharmaceutical drugs. What are your thoughts on things like the FDA, removing patents, potentially allowing things like generic drugs come into market, or and kind of dive into that for a minute?
Those are great questions. I want to make sure my camera doesn't time out. I apologize. Give me just a minute.
It can make your heart flutter if you're like, oh crap, I'm going to lose the feed.
Exactly. So I should be good for another 30 minutes. Okay. Well, that's another book about the FDA.
Dr. Mary Ruart will be on May 1st, diving into this whole conversation.
I saw that. I think that's really cool. So, first of all, I want to make a comment. I see a comment on Facebook. Similar, Sarah JB said, and Raptor. Yeah, there you go. I use this analogy all the time. If people want government to make college cheaper, then get out of it. The reason college is so expensive, just like healthcare, is because the government pays for it. So schools can keep raising their price of tuition because somebody else pays the bill. So it doesn't matter what the cost is. Healthcare is no different. So I like that comment, Sarah JB.
When the only market cap is 51% of the people saying no,
right?
There is no market to make things work better or become cheaper. Because they just keep forcing money into it and subsidizing it. We just saw this week with Obamacare is coming to root here with the fines that people had to pay for not buying insurance. The Supreme Court ruled 8-1 that we the taxpayers are on the hook for, I believe, $16 billion in subsidies to insurance carriers.
I saw that.
And I was one of those people that didn't buy insurance because the options in front of me were terrible and they were expensive and I didn't want them, and I could self-insure for cheaper. But so again, the government getting involved and forcing people to associate with something that they know is broken. So if we can provide solutions, Shawn, if you and I can provide solutions, we might be able to steer a path that isn't towards full government control of who lives and dies, socialism, style healthcare.
Yeah. So your question was about prescription drugs and the FDA and expense. So the patent. Here's the patent. Here's the thing about what I believe about the patent. one of Congress's duties in the Constitution is science and patents. Okay. So I do believe in patent laws. Now, that being said, do I think that drug companies, the law is too long for them? 15 years, I think it is from the time they discover the drug, which means they usually have about 7 years on the market. Probably maybe too much. But here's the thing. I believe in free market solutions. The free market would take care of itself. So Medicare Part D is a perfect example. After Medicare Part D passed, the price of prescription drugs went up 19% the next year. Okay.
Wow.
When I first got out of pharmacy school, the average price of a drug was probably 45 to 50 bucks a month because there were a lot of people still paying cash, especially seniors. I can't remember the last time I looked it up, but now the price is tenfold. Now, wait a minute, tenfold different in 13 years?
Wow.
That is not inflation. Somebody else is paying the bill so they can raise the price. Let's use a great example of a grocery store. Let's say that a patient, or let's say that a person is going to the grocery store. They've got a shopping cart.
Is
And
there
this is not
toilet
original.
paper?
This is in my book. There's a link to it. Dinesh D'Souza did a great video on this. And this is exactly what's happened. Pushing a grocery store cart. The person realizes, wait a minute. I'm not paying for this. So I'll just start loading my cart up with this, loading my cart up with that, put some more into this, put whatever you want in there, even if you don't need it, because it costs you nothing. Okay. So, and here's the worst part. I believe I used to defend healthcare providers for billing the insurances. Okay. But I've met a great doctor called Keith Smith at the Surgery Center of Oklahoma. Please look him up. In fact,
Great
I would love it,
hospital.
Raptor, if you could put him on the bottom of the screen. Surgery Center of Oklahoma. People need to look that up. He, in
Yep.
1997, opened up a cash-only surgery center. People thought he was crazy. Kind of like we were crazy in 2002 when people said we were when we were going to stop billing insurance. Well, now when you look, a lot of people have followed this. There's a lot of cash solutions in healthcare now because it got so expensive. Free market solutions again. So Keith Smith said this. I'm quoting Dr. Smith. He's actually quoted on the cover of my book, Sickened: How the Government Ruined Healthcare and How to Fix It. He felt like an accessory to the crime. Think about this, that grocery store clerk again, or the grocery store shopper gets up there with a cart full of food. And then the grocery store clerk realizes, wait a minute, this person's not paying for this. I can charge whatever I want. Is that not what pharmacies have done? Drug companies, doctors, hospitals? Again, they are accessories to the crime. And until consumers and doctors and hospitals start going out of the system and using free market solutions, cash-based solutions, it won't get better because we can't rely on the government to do it. We just got to quit using the government system. Here's an example at Surgery Center of Oklahoma. Surgery in Georgia, $40,000. Surgery in Oklahoma City, $4,000.
Wow.
Get that.
That's dramatic.
Tenfold. The prices at my pharmacy, the average price of the prescription at my pharmacy are about 7 to 8-fold less than the average prescription at a pharmacy a regular retail pharmacy that bills cash. Why? Our patients pay for their stuff. They pay cash. And some of them get reimbursed to their insurance by billing it themselves, but we have to be competitive. We have to be competitive because they're paying up front. So, and not only that, but it makes us offer better service. When people are paying cash for something, they are my customer. They are paying me directly.
So let's dive into that for a second for people that might not study this stuff as much as you and I do. Okay, let's pick something like an asthma inhaler. Okay, asthma inhaler, albuterol. Okay.
Yep.
Why would an inhaler potentially be more expensive with insurance than it would be cash?
Okay, that's a great question. So when there's an insurance price, the pharmacy, I'm just going to use easy numbers, okay?
Yep.
The pharmacy bills the insurance company. In fact, let me use another example, Anthony, because an inhaler you can't split up into 30-day supplies. Okay.
Okay.
So I'm just going to say 100 days. I'm just going to do a 100-day supply of pills XYZ. Okay. We'll just be generic about it. So what the insurance company does with pills XYZ, or what the pharmacy does, it says your insurance company only lets you get a month's supply at a time. Okay. We're going to bill the insurance company $55 for that month's supply. The insurance company is going to pay us $25, and you're responsible for a $15 copay. Or you could go to a pharmacy that bills that you pay cash at, and they can give you a 100-day supply for $25 cash out the door, and you only got to come back every 3 months. Because
So
what people don't realize,
why is that?
What people don't realize is that insurance price, that huge inflated price, nobody pays it. The insurance company doesn't pay it. They negotiate a price that's a lot lower. It's a racket. It's a scam. So what ends up happening is the cash paying patient, they get screwed. Period. So that's why in most things, first of all, ask for generic medications, ask for 100-day supply, and don't tell people you have insurance. Don't tell the pharmacy. And unfortunately, most pharmacists, they look at you like a deer in a headlight look when you tell them that. It's like the first thing they ask is like, well, what insurance do you have? Well, I don't have insurance. Or you ask, well, what's the price?
Reflex.
Right. Most doctors, most pharmacies anymore, when you ask them a price of something, they're like, well, I don't know. We just bill your insurance. That's the craziest thing. Imagine going to buy a car. What's the price of this car? Oh, we don't know. I mean, we don't really know. What's the price of staying in this hotel at night? Well, we don't know. I mean, we'll bill you in about 6 months, and we'll add a bunch of stuff on there that you may or may not have done. And it's just a big surprise. I mean, people would not accept that. Why do we accept it with healthcare? We shouldn't.
And I think that goes back to the root of the issue that you mentioned is the employer-based health insurance. And when you say you believe that the employee should be responsible for their own insurance, what you're saying as a business owner, because I know some will take that as, oh, he doesn't believe they should have the right health insurance or the right health care.
Nope.
No, what you're saying is you think you can help them in other ways. You could pay them more. They could put money in HSA accounts. They could buy other non-insurance solutions.
Absolutely. And I always, absolutely. And first of all, I realize I don't believe in it myself. We don't believe it in our pharmacy. So I believe I would be a hypocrite if I bought health insurance, traditional health insurance for my employees. I don't believe in it. I really honestly think it's a racket. And I appreciate you, Anthony, for running for insurance commissioner, and you've got more on your plate than just health insurance. I don't believe in it at all. My wife and I have a health sharing ministry. We can get into that a little bit later. Health insurance, traditional health insurance, is a ripoff. I really honestly believe that. It's a racket. It's a scam. So that's why I go to doctors and places that focus in cash. Kevin Hale, you can pop that up there, Raptor. Talked about the DPC model. We'll talk about that a little bit later. But here's what I believe. So as somebody with libertarian views, I want to put myself in everybody else's position. And I'll tell you what, I've worked for companies where they provide health insurance. And from the time I got out of pharmacy school, I realized I was getting ripped off. They were taking $500 and paying into a health insurance that I never used.
Yeah.
And by the way, I was single at the time and had no kids. But yet a family that was somebody that was married and had kids, it was costing them 3 or 4 times as much, 30% more. I don't know what the numbers were. It was costing them more. I believe that I was discriminated against as an individual. I would rather be able to, and I tried to negotiate with my employer. Hey, look, tell you what, don't buy me health insurance. And this is a fix in my book. This is what people should do with their employers. And I know the bigger the employer, the harder it is, but this is what you should do. I don't want that. You give me that money or put it in HSA and then it's tax deductible for the employer, or you give it to me directly and I will decide what I want to do with my health. Because I don't want, does anybody really, honestly, want to be told what kind of health insurance they can have for their employer? I do not want an employer limiting me with my health insurance. I want to decide myself.
I don't think that most people think like that. I believe a lot of people do, but I don't think by any means most do. And the issue is, you and I know that breaking outside the system, there's viable other solutions that are cheaper and healthier. But others are just so conditioned to, oh, you go to HR day one, you sign up for your benefits, and you get your 40 hours of vacation time, and you get your 1 week of sick leave, and that's what you get, right? And it's become such a conditioning, such of a small handful of companies offer all these different benefits to begin with, and now pretty much every company is going to be within a few degrees of the same benefit package, right? For the most part. And nobody even knows to look outside, right? Nobody knows to ask that question because they haven't even been taught that there are other solutions. And one of the things that's important to me for this campaign is to be able to provide solutions.
Anthony, just look at some of the comments coming up.
Yep.
Look at the libertarian comments. I mean, go ahead, Anthony. Sorry to interrupt. Go ahead.
No, we need to be able to, provide these cost-saving solutions now, because while, getting me elected into office, right, we can hopefully change a couple things. We can move the ball the right direction, maybe save some folks some money. But ultimately, there's a giant rat's nest that's way bigger than anything I'm ever going to be able to tackle as one guy in office. So while the Democrats and the Republicans are arguing about this and not fixing anything, if we can provide solutions like health ministries, which we'll dive into here in a second, or direct primary care, by paying cash for pharmaceutical products, that provides solutions to people today that don't have other options. People that are out of the system already, that don't have health insurance because they think it's a racket, but they don't have any other solutions.
Right.
And the insurance commissioner should be helping those people. He should be talking about these solutions more, and he's simply not.
I totally agree with you, Anthony. And from an insurance commissioner position, I totally get what you're saying. I, though, do not want to stop the fight about the free market system and how individuals should be empowered with their own health care. And that means choosing doctors that don't bill insurance. And speaking of DPC, they're out there. And you want to talk about you want to see the doctor? You want to text your doctor?
So let's tell the people what DPC is.
So on our show, Health Solutions with Shawn and Janet Needham, on the second episode, Carl Lambert with Ready Medi Clinic out of East Wenatchee, he is on that episode, and he talks about DPC. But we've had two other DPC providers, one out of Spokane, one out of Yakima. DPC is direct primary care, and basically what it is patients pay a monthly membership to have 24/7 access to their provider. And you're going to think, oh my goodness, what's that going to cost? What is this, concierge medicine? What's it going to cost? $700 a month? No, try 50 to 70. Yes, I'm not kidding. $50 to $70 per month. Yeah. Okay. This is what happens when free market healthcare is involved. And by the way,
what type of stuff do those places cover? Right. So if you buy a DPC, let's dive in a little bit more. How does it work? What does it cover?
Right. Every DPC is a little bit different. They have different services, and some of them have different levels about what is covered. If they have specialty services, some of them for $70 a month can offer, if they have an X-ray machine, if they have, I can't even think of some of the services, but routine visits. If you have a cold, let's say you have strep throat. You go and see them. They diagnose it as strep throat. You pay nothing extra. They give you a prescription. A lot of times they can dispense it right there out of their office. It'll be like a few dollars. It won't be a $30 copay you never know what it's going to be at the pharmacy, because they have no idea what the price is until they bill your insurance. That's a racket.
Unless they go to a cash place.
Exactly. Like right. And so there's a big surprise. So stitches are covered. I mean, there are stories. I love talking to DPC guys because not only they're usually, as you can imagine, they're liberty-loving people. That's why they chose that. They did not want to be slaves to a hospital system or a big group of doctors that are controlling them. And literally, let's face it, I'm going to get some kickback about this, but when you're in a system like that, a big system like that, whether you are public or private or not, if most of your funds are coming from government funds, and most all facilities in Washington State especially, 70% of their funds come from some government source, whether it be Medicare or whether it be Medicaid. In my opinion, they are a government facility. That's my opinion. They're a government facility. They are controlled by Medicare and Medicaid. The only way when Medicare and Medicaid start asking, questions, they really tout to them. But guess what? That's what I don't like about those facilities. Who's the customer in those facilities? When you're a patient, you go into one of those facilities that bills a third-party insurance. Who's the customer?
Yeah,
The patient's not paying the bill. The
yeah.
insurance company is. Guess who gets better service? The insurance company does, not the patient. But you will go to a DPC provider. Oh yeah, they will give you the best service they can because you are paying them directly, and they want to keep you as a customer. It's beautiful. It's a transactional relationship. It's how free markets have worked for thousands of years. It works. And I love working with those type of clinics. So many of them offer different kinds of services, but even telemedicine. Before this whole lockdown thing, DPCs were doing telemedicine before.
Yeah.
And
Yeah,
they
like
can,
that's old hat. Like we've been talking about that for years. Like
right.
how can we make it easier and more prevalent? Like that's it's not like because the insurance commissioner, right when the virus came down, he's like he waved his magic wand, he put his crown on because he's the guy in control of everything, and he says, "Insurance companies, you're now allowed to cover more telemedicine." And
Right,
I was like,
right.
"No shit, Sherlock.
Right.
Like, how about you just let him do it anyways?"
Can you imagine? I mean, and can you imagine being a doctor or a pharmacist or whatever, and you're being told you're being controlled by an insurance company?
Medicine, how you
Right.
can provide
Went to
medical
school.
care.
Right. You went to school to practice medicine or practice pharmacy, and you're being told by somebody else how to do it. That's why I got out. And that's why I love what I do now, because I have freedom from that. My wife and I are liberated from that system. And there is nothing between us and the patient. We love our patients. We take care of our patients because we are financially invested in them and health-wise too. And we want the best for them because it's the best for us. I love it. It's a great system.
It's a mutually beneficial system that where you both are being able to help each other, accomplish what your personal goals are. That your personal goals cross paths at that moment in time. Whether that's you as a business owner having a personal goal of paying a mortgage, or I as a patient having a personal goal of getting healthy. We diverge there. We shake hands,
right,
and we go about our business, and we do it cheaper because we're paying cash and we're looking each other in the eye without having a third party biller.
Right. That's exactly right.
So direct primary care is something that works very much like a gym membership, and you can get some basic coverage for the everyday thing you might typically go to the walk-in clinic for if you don't have a primary care physician. You can do it for a fraction of the cost. And if we allowed people to do that and empowered them, talked about it, educated on them, taught 16-year-olds about it, right? So when they're talking about getting a job out after high school, they know what other options other than just the company insurance that exists. If we got more people put in those situations, especially those that don't have insurance, that truly have no coverage now, direct primary care could help them in any day situation. To do that and make that completely healthy and safe from a financial perspective, I completely agree with you. We need to allow catastrophic insurance plans again, because a DPC type, $75 a month for your routine medical issues with maybe a catastrophic health insurance over the top of it in case you get something more dramatic like cancer or Alzheimer's or break your back or whatever, right? So you can put those two solutions together and save money overall. On the healthcare topic, you mentioned health ministries.
Yep.
Dive into that for a little bit. Why you as a business owner like it, and you as maybe just an individual as well.
Okay, so Jenny Vaughn, I'm going to piggyback off her question because she says the one before that, her question before that, it's super expensive and it's darn near impossible to negotiate with a hospital. That is not true, Jenny. So when you use a health sharing ministry, and believe me, I've done this. I've done this. So I've got stories in my book about this. So when you use a health sharing ministry, and I they used to be called only health sharing ministry because there had to be a faith. They were faith based. Okay. The great news is when the individual mandate was removed from Obamacare, it allowed non-faith-based ministries, okay, non-faith-based health sharing programs. So New Health, KNEW. Check out my Facebook page, Shawn Needham. We did a live interview with New Health, one of their health coaches and their one of their director of membership. Monday. So it was Monday at 1 to 2 p.m. on my Facebook. Check that out. They talk about how they can save people money. And one thing they do is, let's remember, when there's a $200,000 hospital bill and Premier Blue Cross is billed $200,000, they don't pay $200,000. They probably pay more like 50. So the first thing you do in a catastrophic thing like that, if you have one of these health sharing programs, those health sharing programs are what they do is they're called health shares. So everybody pays, I'm just going to use easy numbers, $500 a month. Okay. And if, Joe Blow gets cancer, those health shares go to pay for his cancer that month. I will tell you, it works. It sounds so crazy, but it works. And it is so much cheaper. So go Samaritan Ministries, Christian Healthcare, which is what my wife and I are members of. There's Liberty Share. Just Google health sharing ministries and they'll come up. And the prices are anywhere.
And there's a lot that aren't faith-based now
Correct.
as they're starting to get into the market. And sometimes those are a little more expensive, what I've noticed. I think they sometimes cover a little bit more. There's less maybe personal belief coming into play, right? They're just trying to offer something cheaper.
And that's what's cool. That's why I mentioned New Health. And it was perfect timing for my book, because I was worried in my book when I wrote, you can use a health sharing ministry. That's one of the fixes. Well, what if I don't have any faith? Darn it. Well, it was perfect timing. New Health came out and I interviewed James Maskell, the founder of New Health. And that's actually, if you look at our radio show, Health Solutions with Shawn and Janet Needham, there's an interview with him, and a great interview. And he talks about these crazy expenses and how they can save people money. So you negotiate that bill down. And I know that sounds crazy, Jenny, but it really does work. Let me give you a good example. So, and this is in my book. When my son was at Mission Ridge snowboarding and he broke his wrist. I mean, his wrist was like, and I'm like, okay, well, let's not stress out. But it was it was an emergency. I mean, it wasn't really an emergency, but it was an urgent deal for him as a 14-year-old. To me, as his dad, it was an emergency. If it was my wrist, it wouldn't have been an emergency. So I go to the only place I could go down to. First of all, there's a great nurse down at the aid station that splinted him up, and then we took him to the only clinic in town, and there's a walk-in clinic, an urgent care, and an ER in the same door. And of course, if you guys don't know what's going on there, it's just all semantics. It's just all a ripoff. It's all a scam. They bill the insurance company, depending on how they code it. Same doctor, same x-ray machine, same room. It's a scam. Okay. So immediately when I walked in, I told them, I says, look, I don't have any insurance. The first thing they said is, they says, oh, I'm sorry. Well, you're sorry. I'm going to pay the bill today. I mean, you don't have to be sorry. I'm going to pay for you today. I'm going to pay it today. And they gave me some paperwork to fill out for state assistance. I'm like, no, I don't need that. I'm going to pay you today. Of course, they says, well, we have no idea what the charge will be, which is crazy. Well, it's just so complicated. They said, well, I don't know. Buying a car is pretty complicated, but when you go down and buy a car, they know exactly what it's going to be.
Yeah.
And if you want an extra set of keys or gold wheels or different tires, they'll tell you exactly what it's going to be. Don't give me it's complicated. It's not that complicated. And if you go to a DPC physician and you ask how much it is, they know exactly. Okay.
Yeah.
They'll know the exact price.
It's because we're stuck in the rut of the mindset. People, their chains of, they're chained to this, what they know, what they've been taught. Right. And it's the only way, until somebody like you can come out and encourage them to be like, look,
And
this will
that's
be
why,
healthier for your business. Will be healthier for your
right.
patients.
And that's why I believe, that's why I wrote a book. That's why I have a radio show. I want to educate and empower individuals to be in charge of their health. Anyway, the doctor told me that he's going to need a pin in his wrist, and they didn't know what the fee was going to be, and they said they'll send me a bill, which is totally ridiculous. I was hoping I could get a discount if I paid up front. I couldn't. So not there anyway. But you know what? I love free markets. So I called up Samaritan Ministries right away, and I said, hey, is there any doctor that you know of that can do that, an orthopedic guy that can do that you guys work with that specialize in cash? Well, let's see. You live in Moses Lake, we're kind of small in the middle of nowhere, kind of.
Yeah,
I
thinking maybe there's nobody nearby.
Right. Found a guy in Tri-Cities. They said, hey, there's Tri-Citic Orthopedics in Tri-Cities. I called them. They said, hey, can you get down there to see me today? Sure. Hand specialist. I go to see this. I said, oh, by the way, I don't have insurance. What's the cash discount? They said, oh, well, normally it's about $350. Cash discount, $112 to see a hand surgeon. A hand specialist, $112. It costs more than that to change the oil in my diesel truck. $112. Healthcare does not have to be expensive. It doesn't. So anyway, he ended up needing surgery. They got him in right away. Normal price, $2,200. My discounted price, because I paid cash, $700. Okay. At the time I had Samaritan Ministries. Samaritan Ministries works different than some of them. They send their direct shares to the individual people. So we got checks from people all over the world to help pay for my son's wrist. Now, mind you, at the other place, at the other hospital and clinic, they couldn't really give me a price, but I know somebody had the same thing that happened. It was over $10,000. We paid $2,200.
Wow.
And we got way better service. Way better service.
And you extrapolate that over one city, right? And that's millions of dollars over a state. That's billions over a country. Right. That's trillions each year in just extra cost.
And by the way, the hand surgeon specialist, he said my son didn't need a pin in him. He just needed to be repositioned under x-ray and recast it. And he's 14 years old. It'll grow in fine. He was fine. He didn't need a pin. Why did the other place want to put a pin in?
Yeah, they're trying to have to check boxes and part of the system
and money, and they'll make more money at it. Yeah. And by the way, I'm a capitalist. I've got no problem with people making money, but I feel it is my job to educate and empower consumers that they need to know that. I'm okay with it, but patients need to know that.
Yeah. Well, I appreciate what you're doing for the community out there.
I got to restart my camera too before it times out. Hold on just a second. My camera, speaking of government regulation, so my camera, and I knew this when I bought it, but it was supposed to have a timeout. It was supposed to be able to override this feature. There is an auto power off, and in order to prevent paying a certain tax in Europe, this camera has to shut off within a half hour. Has to.
Otherwise, they pay an extra $8.
Otherwise, they pay an extra tax. It just goes to show you how the government screws up everything.
Yeah.
Anyway, so what questions didn't we answer? Let's see.
Yeah, let's just dive into this. So just one or two real quick. We've coming up on an hour. So Whitney, pharmacist more authority over diagnosis. Shawn, so that's something that you would probably deal with on a direct basis. So talk about, what you can't do as a pharmacist that you think maybe you have the knowledge base to do.
Right. Okay. So diagnosis, if you use that word specifically, that is something pharmacists cannot legally do. Now we can make recommendations, but we can't make diagnoses.
So I think she's saying that in other countries they might have more ability to dive into that. So
correct.
So not what can you not do right now, but what would you see any hangups there that are costing people money or that you might do otherwise if the government wasn't stopping you?
So let's remember this, that depending on the numbers, anywhere from 70 to 90% of chronic disease can be prevented. And that caused chronic disease. If you watch my radio show I had with my brother, my podcast with my brother earlier this week, we talked about the biggest epidemic in America, the biggest pandemic in America. It's not COVID-19. It's chronic disease. It's obesity. That's the biggest pandemic in America. It is killing more Americans than COVID-19, and it will continue to kill. COVID-19 will come and go. Unfortunately, obesity probably won't. I want to educate and empower people that they can control that. So most things can be prevented in the first place, okay, with chronic disease. Our country healthcare system profits off chronic disease. You could make a very valid argument that there's a lot of people that are vested that don't want people to get healthy. We won't go down that rabbit hole, but
That's a 2 hours
yeah, it
after
is.
hours
It is
episode.
absolutely. So that being said, though, let's say athlete's foot. Let's say you come to your local pharmacy, you say, "Hey, my feet are itching. I've got some redness on my feet, and they're really itching. I work out 5 days a week, and my socks get sweaty. And okay, well, my guess is you probably have athlete's foot. If I was you, we can't diagnose that, but if I was you, you could buy this cream called Lotrimin, clotrimazole generic, and apply it to your feet twice a day, and it will probably go away. But we really can't diagnose unless we're working in collaboration with another provider. So either an ARMP or somebody that can prescribe an ARMP, a doctor, something like that, or a PA, something like that. So, and I work with a lot of different DPC clinics, for instance, and different doctors and providers. And I love working with them in the team approach. And they will call me many times and say, "Hey, I've got a patient with such and such disease. What drug would you recommend at what dose?" That's what I think. That's why I like what I do. When you look at traditional pharmacies, a lot of pharmacists just count and pour pills and bill insurance. And really, the systems created that, and pharmacists have allowed that. My wife and I wanted out of that. We wanted to use our knowledge and to help patients and to make a difference in their lives and to educate and empower them. And that's what we do at our specialty pharmacy. We have a specialty compounding pharmacy.
Well, and I hope we've done that tonight to some degree. This is a lengthy topic. We're coming up on an hour chat here, so I think we should probably call it an evening, let people get back to their families or whatever other live stream their friends are bombarding them with to watch right now. So if you have any questions about any of this from a health perspective, from a business perspective, feel free to reach out to Shawn. His book is available on Amazon. I think you can see that in the background. I highly recommend you read it. He knows what he's talking about. He's lived it on a personal basis and on a professional basis. So, Shawn, I appreciate you sharing that knowledge and experience with us today.
I have a question for Jenny. Jenny wrote up there. What did she write? She said, "Please put your Facebook page and the new health insurance." Okay, so Jenny, my name is Shawn Needham. I should have had it on my stream. Sorry about that. So Needham, Needham. Can you put that up on the banner? My name, please, Raptor. And it's new health insurance, as in KNEW Health. KNEW Health Insurance, or not insurance, New Health, KNEW Health. And maybe we can put that up on a banner too. So my name, and you can go to my Facebook page. I'm in Moses Lake, Washington. Also, please check out my book, Sickened: How the Government Ruined Healthcare and How to Fix It. Most of this stuff is in there. And it's real. It can happen, but we have to make it happen. We as Liberty lovers, KNEW Health. KNEW Health. We as Liberty lovers have to make it happen. Okay. We have to drive it. Remember, in a free market, it's consumers that drive it. Let's not let somebody else drive it. Let's drive it ourselves. And if we are educated, KNEW, no, you. We'll get it right.
I'm terrible at that stuff. Luckily, it's.
I'm glad we have somebody helping
else's. Yeah, we're blessed to have the man behind the curtain here.
Yeah, absolutely.
Spelling challenged or otherwise.
There we go. New Health and Shawn Needham. So check out my Facebook page, because we just interviewed New Health on Monday. So if you scroll through my Facebook page, it's also on YouTube, the Moses Lake Professional Pharmacy's YouTube site. There's a archived version of that, an edited version without the commercials. So I appreciate you having me on today, Anthony. I have a passion for this subject, as you might be able to tell. I believe it is my purpose in life to educate and empower individuals to take charge of their health. And this is one of the ways I want to do that. So I could talk about this for hours and hours. So thank you for having me on so much today. It has definitely been an honor, Anthony.
Well, it's good to see your face, my friend. And, I will be in Moses Lake on your radio show, streaming on the airwaves in the Moses Lake area, I believe on May 11th.
That's correct.
We'll take a conversation there. Everybody, thank you for joining us tonight. We don't have a Patreon. You can't donate in that way, but I am a candidate for office. Your money is always appreciated. We're coming up to filing date here for election in about 2 weeks. That means filing is going to cost us about $1,400. If you could buy a bumper sticker, a sign, a beer koozie, a little cool little bracelet like this, a pocket constitution, every little $5, $10, $20 purchase helps. You get yourself some cool swag, help spread the word, the Be Free movement here to really fix healthcare in a tangible way that'll make things cheaper for everybody the day that we start implementing these changes. So appreciate you tuning in today.
All right.
Cool. All right. Have a good night, everybody.
All right. Good night.